Welcome all to Off the Cuff with Namrita. Hope you all are having a wonderful weekend. And today I have a doctor in the house, and we will be talking about the M word. I'm talking about menopause, and statistics say women experience depression twice as often as men. Irritable bowel syndrome affects twice as many women as men, while gastro-esophageal reflux occurs in two-thirds of all pregnant women. Women are at greater risk for health problems like osteoporosis and breast disease. And women's health research is hugely underfunded when compared to spending on conditions that affect men, according to a new analysis of data from the US National Institutes of Health. But today, like I said, we are going to focus on one extremely important condition that all women go through, menopause. And it's not optional, ladies. Everybody has to go through that. And we all have different symptoms for that. So I'm so happy to be talking to Dr. Prasanna Menon here with me in the studio. Dr. Menon, welcome to Off the Cuff.
Thank you for inviting me, Namrita.
It
It's
is
nice to be here. It's a
lovely.
privilege.
Oh, thank you, and lovely to talk to you. And I'm meeting her after ages. She was my gynae too, a long time back, and it's wonderful to meet up with her. A little bit about Dr. Prasanna Menon. She's MBBS, MD, and FACOG. That means Fellow of the American Congress of Obstetricians and Gynecologists. She's been practicing in the US from 1992 till 2020 and currently is working for a non-profit. She's also a member of North American Menopause Society and many more, affiliated with many more organizations. Dr. Menon, my first question is, and I hope men will be listening to this conversation too. And taking interest, because it is a very important conversation for both men and women. So if we have to say, what is menopause?
So, as you rightly said, menopause is a physiological process.
Okay.
It is not pathology. It's not an illness, not a disease.
Okay.
Menopause is a transition from a reproductive to a non-reproductive phase of life.
Okay.
So this happens when the ovary runs out of follicular activity.
Okay.
We need follicular activity to release eggs so that a woman can get pregnant.
Yes.
So when the follicular activity stops, hormone production declines.
Yes.
When that happens, women stop having periods.
Okay.
So normal or natural menopause is diagnosed clinically.
Okay.
It is not diagnosed with lab test.
Okay.
So natural menopause is when a woman starts noticing changes in her body and her physiology. It starts at the age of 51 in this country.
Normally.
But in certain parts of the world it starts around 47. In India they say it's 46.5 years.
Okay.
So it starts because the ovary declines in its follicular activity. And then the women start noticing changes in their cycle. So we diagnose retrospectively. That is clinical diagnosis, not a lab-based diagnosis.
Okay.
So we retrospectively diagnose that after her period, when a woman does not get monthly cycles for 12 consecutive months, then retrospectively we say that final menstrual cycle was the day she attained menopause.
Menopause. Okay.
But in the case of when the women have a uterus removed, her period stops right away.
Yes.
So in that situation, diagnosis is made by lab tests.
Okay.
Another condition is called surgical menopause, where a woman has to remove her ovaries because of conditions like severe endometriosis or endometrial cancer, that is uterine cancer.
Yes.
Then when we remove ovaries, the hormone levels abruptly drops, and then she has all the significant symptoms of menopause, and which could be very severe.
Okay.
So that is in a gist as what is menopause. It's a normal, physiological. It's a when you say You shouldn't say normal physiologic means normal.
Yeah.
It's a normal biological phenomenon. There's changes in the physical structure, there's changes in the psychological structure, there's changes in the social. There's so many changes that happens during menopause, but that is menopause. It's a normal change. And as you said, it happens to
everybody.
Where the periods permanently stop. So that's a good thing.
That is true. So like you're saying, it varies in ages and when it starts. So because I've heard about perimenopause, then this. So what is the common terminology to describe?
So again, this is because of the research being done recently.
Yeah.
To explain this phase of life, the terminologies have been implemented. So it's easy for us to explain to women what is happening.
Okay.
So the word perimenopause, menopause transition explains the symptom period.
Okay.
Usually the symptom starts usually 2 to 7 years before the final menstrual cycle.
2 to 7 years, okay.
And can usually last for 1 year after.
Yeah.
But for some women, 10 years late also, for a decade or more,
wow.
they have the symptoms.
That's the thing, you don't know.
Yes.
Very unpredictable, you said. Predictable.
Unpredictable phase of life. Predictable, unpredictable phase of life.
Very true.
Very true. So there's, in these, so when women are in perimenopausal period, it's extremely difficult because you have hormone production some months, the follicular activity happens some months, and sometimes it doesn't. So it's like a roller coaster ride, and it differs. I mean, your sister may have a difficult time, but you may not have.
Yeah.
So day to day it differs. Yeah. So it's that's why it's very unpredictable. So so when women don't know. Because we wait 12 months, right, to say that.
Absolutely, yes.
So you pack and you go for a vacation saying, I'm not happy for 6 months, and then you get it. So take your pads with you.
I know. Okay, good idea. And like you're saying, again, it's unpredictable. Even the symptoms are pretty unpredictable in everybody.
Yeah, and the severity also.
Severity also. And does genetics work? If your mother has had, a tough time, you will also have a similar kind of menopausal state. Or
well, you can ask your mother, but usually it doesn't go by that.
Okay.
Your environment here is different.
It's different. Okay, but what are the common symptoms basically?
Before I get to that, you said there are terminologies, and
yes.
you talked about the age.
Oh yeah.
So I just want to talk about what is. We talk about natural menopause is 51.
Yes.
And then there's another term which is important that they've coined recently.
Okay.
Is called early menopause.
Okay.
So early menopause is when a woman gets into menopause between the ages of 40 and 45.
Okay.
And then I'll tell you why this terminology came in a few seconds.
Okay.
The other terminology that we used to use as premature menopause, we no longer use that word. We now call menopause before the age of 40 as premature ovarian insufficiency, POI.
Okay.
And the reason why it's important for women to understand these two diagnoses is that both are associated with the increased risk of cardiovascular events, osteoporosis, and cognitive decline. And severe symptoms. So that is why it's important to know these two conditions too. Now coming to answer your question, what are the normal or common symptoms?
Yeah, common ones.
So you can club them into the hallmark of menopause. You can club them into 3 major categories, and there are many others too. And then 2 silent severe risks. So the 3 major categories is the vasomotor symptoms, where people or talk about hot flashes.
Yeah.
And then there's genitourinary symptom.
Okay.
And then which you alluded to in the beginning, all these mood swings. And,
yes.
And onset of depression and all that also is one of the big significant factors. So in the first group of symptoms, we talk about vasomotor symptom, what is commonly known as hot flashes.
Yeah.
By the way, I like what author Gail Sheehy, when she talks about hot flashes, she uses the word power surges.
Oh, power surges. I like that.
It's much a positive spin on the word.
Exactly.
Yes. So hot flashes is an experience where women feel feeling of heat on the face and upper body, but not in the lower body. And when it happens at night, we call it night sweats, and it can disturb sleep when that happens.
Okay.
So some people get it, some women get it a few times a month, some get it a few times a week, some get it every day. The severity, as we mentioned, it goes up and down. So just because your sister had a severe symptom doesn't mean you, or your mother had severe menopause doesn't mean you need to have.
Okay.
So it varies. And then the other group of symptoms that is common is called the genitourinary symptom of menopause.
Okay.
That is associated with changes in the lower reproductive tract and the lower urinary tract. So the vagina, which is the lower and the lower portion of the urethra, the lower 1/3 of the urinary tract. That's called the urethra. That's the pipe that takes the urine out.
Yes.
So those two are affected when we enter menopause, because those two are also have estrogen dominance.
Okay.
So when the symptoms of the vaginal part of the genitourinary symptom is dryness, itching, pain with sex. And with the lower 1/3 of the urethra, women will have a frequency going for urination.
Again.
Or have burning.
Okay.
Or sometimes the first bladder infection or urinary tract infection happens during menopause. And then the other group we talked about is the mood changes.
Mood changes.
So the mood changes are sometimes could be mild, sometimes could be severe.
Yes.
And again, it varies.
Yeah.
But when you have a previous history of anxiety or depression, that can be triggered by menopause. So you may not have for so many years, and all of a sudden you're feeling depressed and you don't know why. Think menopause. Okay. And then you do need treatment for antidepressants, because hormones alone won't help you there. And then there are other sets of very silent, before we go to the silent risks, I'm going to talk about other common things that women may have is headaches, muscle ache, hair loss, sleep disturbances. I can't fall asleep, or when I get up to urinate, I can't go back to sleep. I have no desire for sex. I think I've lost my mojo. All those things are also commonly reported in the experience. And then the two major you alluded to that also, the silent risk factors that we all need to know. One is osteoporosis, and the other one is cardiovascular risk. So we know that the estrogen actually helps protect our bone, and estrogen is also cardioprotective gives us a protection. So when estrogen levels goes down, we lose that protection. We do know also that 6% of bone loss is lost by both women and men after the age of 35. Okay. But women, when they enter menopause, they lose 12% drastically within the first 4 to 6 years. Wow. And if that loss continues, then she gets osteoporosis, or what is called brittle bones. Yes. So she's at risk for fracture. And also we know when women enter midlife, we bring about certain risk factors with us. Yeah. Which is, we put on weight, and more so in the abdominal fat. We may have high blood pressure, we may have diabetes, we may have high cholesterol, and we probably are not doing our exercise regularly. And some of us are with high stress level. We're trying to achieve something high in the profession. Our children are leaving home, going to college, or we are taking care of our elderly parents. All these risks also increase our risk, and so it's all augmented when we go into menopause. Very true. And then those are something. And I want to tell you that it's this cognitive impairment and all these things. There are lots of help right now. It's not like the end all. And even if if you look at studies, there are some women who enjoy sex after menopause. So it's nice. So it's not that everybody has a problem.
Yeah. It's the way you deal with the situation, get the right information, get the right resources, I'll say. That's right. And I read somewhere that Japanese women associate headaches, shoulder stiffness, chilliness with menopause. Filipino women often get headaches, but they seldom experience hot flashes or power surges, as you said. Indian women might feel bothered by the cycle changes, and might experience hair thinning. So I don't know. So menopause affects differently as far as culture, where you come from. I don't know if that's true or not. So does your environment, your upbringing, your culture affect the way menopause happens to you? And main thing is, like, now that I'm of that age, how important is nutrition for women, especially Indian women, because our food, how it is. Yeah.
So talk about South Asian women.
Yes.
So again, when you want to talk about anything and you want to offer help, you always want to base it on evidence-based research.
Okay.
So when you talk about, if you look at the research done on minor ethnic groups,
yes,
there's a dearth of research information.
Okay.
So there's some published data from UK and Australia show that South Asian women tend to have more genitourinary symptom of menopause. That means vaginal dryness, itching, pain, decreased desire, and some of them have changes in the libido. And you said, is it because of a change in the environment? Yes, of course, it is a change about. Sometimes they feel isolated, and their social norm is that some of them say, don't talk about it, because it is not a big deal. Everybody goes through that, so what's the big deal? And then some women say, I don't want to talk about it because people think that I'm not feminine anymore, right? So that is one thing. And some women, which is a good way of thinking, is say that I like it. I'm gaining wisdom, so I'm okay with it. So these are all the spectrum what South Asian women feel. But sometimes it's to do with the fear. They don't understand hormone replacement therapy.
Yes.
And so, and their social connection don't believe in it. And so they don't even want to talk about it. So that's all some of the things. And also wanted us to know that living in the Bay Area, at least what is known also by the research is that in UK and Australia is that intimate partner violence issues are not brought up with the physician. Depression in this population is not brought up with the physician because the woman doesn't connect menopause triggering depression. So that's not. And also relationship problems because of desire of sex, less desire with sex, or pain due to sex is not discussed with the significant other, and there's a tension in the relationship.
Yes.
So with regards to risk factors seen in South Asian women, we talked about what are they in the midlife, and that's what they see in South Asian women.
Yeah,
there is more central obesity, abdominal fat because of the diet, and then there is also increased risk of polycystic ovarian syndrome.
Yes.
So if a woman transitions to the menopause with that history, the risk is higher. And then some of them have high blood pressure, insulin resistance. So all these things, when the South Asian women are known to have higher risk for these. So they are higher risk for cardiovascular events, they are higher risk for cognitive impairment, they are higher risk for osteoporosis. So it's important for women, South Asian women, to, as you said, what can we do? Can we change the diet?
Yes.
Extremely important. Lifestyle. Concentrate on lifestyle changes. You can do that. So if you can change your exercise schedule, try to, even 5 minutes. I used to tell patients, try to park your car a little far, walk. So that itself, or between when you're working, go up and down the stairs. So try to, do that. Then change your diet. So again, there is no studies, there's no evidence to say this diet works better than that. So if you follow a diet which has shown improvement for cardiac reduction, cardiac risk reduction, like Mediterranean diet, probably it's good for this phase of your life too. So, and then, so I wouldn't encourage women to go ahead and buy things and supplements so that because there is no evidence. So now, there is no evidence. There is an ongoing study called the SWAN study. It's the study of women across the nation. They have included ethnic minorities, but I don't know how many are there. So that may give us some information on the diet and lifestyle. But right now, do your exercise, watch your diet, eat a cardio protective diet, watch your sleep hygiene, be sure you get your sleep, and if you have any psychological issues or depression, approach your doctor and try to get that resolved so that we do not have to suffer in silence.
That's wonderful information, Dr. Menon, and I think we can talk so much more about it. The only thing is, like for South Asian women or South Asian Indian women, we are grappling in the dark sometimes, because like you're saying, we are not sure about hormone. Generally we say, oh, no to any hormones in our body, so we are scared of that. So how can they approach their gynae to talk about menopause or what they're going through? And also from because the time is running out, I'm going to just ask, how can people help in the house, especially the husband? How can he help the partner?
So the important thing to realize, very good questions. Important thing to realize is the husband needs to know this is a normal physiological process. And I like the way where Dr. Mosconi puts it, that women go through these upheavals many times in their life. Puberty, there's a hormone upheaval. In pregnancy, there's hormones. So perimenopause is also, but it's not understood. So if they understand they're supported during the pregnancy, they should support during perimenopause. So these are just physiological changes, and it's not going to last forever. It's going to improve. So be with that and understand that's what's going on, and support when she doesn't want to have sex because she has decreased libido. We have options. We have help. So come along and discuss with the gynecologist that this is what you're facing. And then when you write down these symptoms, or help her write down these symptoms, if you observe symptoms that she's having, write it down for her. And then when you approach the doctor, maybe the doctor can't attend to all the symptoms, but mention 2 or 3 most bothersome symptoms. So if you're saying that I'm bothered by not being able to have intercourse, then we talk about that. There are so many ways to help with that now. So many safe ways. So do you have to have hormones? That discussion should be with the patient and the doctor. And so it's not that everybody needs hormones, but there are so many other viable options, safe options that we have now to offer women. So it's an exciting phase to go into menopause now.
Good spin on that. And that's what, like, lots of creams and whatever works for you. I think the doctor knows best, I can say. But like Dr. Menon is saying, there are a lot of options. You don't have to go through these drastic changes in your life, and we accept what's going on and be aware of what can be done with it. That's what we learned.
And remember, you've done this before, puberty and pregnancy.
Yes.
So even in those conditions, there was upheavals and there was medical risk. But you came out with resiliency, recovery, and personal growth.
Absolutely.
Right?
I think, life goes on. Life does not end with menopause, women. All I'll say is that, society might lay down certain, rules on us, saying that, okay, if a woman is no more fertile, that's about it. But we are in a different world, in a different culture, and a different time. I think start living the life. It's exciting. Start living the best you can. Like you're saying, take care of yourself.
Take charge.
Take charge. Absolutely. And to the husbands, as communication is key. Ask your wife as to what is going on with them, and understand, and then approach the gynae if need be. Or therapy is a great idea too. So because of the time, Dr. Menon, I have to take leave. Thank you so much for listening. We'll do another segment on this as to what needs to be done after. And thank you for joining. Thank you, Dr. Menon. It was a delight talking to you. I learned a lot myself, So
thank you so much for giving me this opportunity. It was a privilege to talk about menopause. And I think yes, as you said, both women and men need to know about it.
Absolutely. Take care and have a wonderful day ahead. Bye-bye.
Thank you.
Thank you.
Shosha is a creative Indian restaurant located in the heart of Silicon Valley. Shosha is a woman-owned business that serves traditional Indian flavors assimilated with molecular gastronomy techniques. The best Indian bar with happy hours in the Bay Area serves handcrafted drinks inspired by flavors from India with modern craft cocktails that are presented in unique ways. Shosha is a modern take on traditional Indian cuisine. We specialize in corporate luncheon, anniversary celebrations, birthday parties, and catering. Do check us out for a memorable modern Indian dining experience. Shosha is located at 141 South Murphy Avenue in Sunnyvale, California.